Hello and welcome everyone to our last Women's Health Tech Wednesdays of 2024. I am your host, Nina Joshi. Have one quick announcement before we bring on our guest for today. The tickets are available for the New York Innovator Summit for next year in May. So make sure that you go ahead and you grab your tickets using the QR code or the link in the chat. And with that, I would like to formally bring on and introduce our amazing guest for today. Dr. Sarah Temkin, who's the Associate Director for Clinical Research at the Office of Research on Women's Health at the NIH. Thank you so much for being here, Dr. Sarah.
Thank you so much for having me. I'm just
I
so
am,
happy to be here.
oh, I love it. We are so happy to have you on and just learn all about what you're cooking over at the NIH. And for anyone that's on the call, if you do have questions for Dr. Sarah, please use the Q&A or the chat feature, and I will make sure that we get to it towards the end of our conversation. And so maybe Dr. Sarah, I think a great place to start would be if you could just share a little bit more about your career journey with us and really how you became involved in the Office of Research for Women's Health at the NIH.
Yeah, so I think it's obviously like everybody's career has ebbs and flows and comes and unexpected turns. For me, I was trained as a gynecologic oncologist, which meant that I spent my time taking care of patients who had malignancies of the female reproductive tract, and delivering medical and surgical care, and it was the greatest job you could ever imagine, but taught me so much about women because women are complicated when they get sick as they get older or they develop a chronic illness. They often have lots of additional issues,
Mm.
like caretaking. Women may not always have a caretaker when they're older or sick, or it may be their child instead of a spouse. And also, women have different comorbid conditions. And so, as part of my experience as a physician, I took a lot of care of a lot of people with a lot of a lot of complicated things. So I came into the Office of Research on Women's Health in the NIH in 2021 during the pandemic.
Wow.
And that was just a wonderful and exciting opportunity to be able to contribute at this particular moment in time when there's so much attention to women's health, and think about how we as the NIH can support research that is centered around the healthcare needs of women.
That's incredible. I mean, I have so many questions to ask about what it was like being there in 2020, but I feel like before we get into that, I think that, the NIH is such a large organization. I think it'd be really awesome if you could tell us a little bit more and provide more background on the work, kind of specifically in the Office of Research for Women's Health and kind of what you all kind of work on or some of the things you prioritize over there.
Yeah, so the NIH is a very big organization, with a budget that is approximately $50 billion a year. And
Wow.
there's thousands and thousands of employees. And so the NIH is made up of 27 institutes and centers, each of which has its own mission, um, priorities, vision. And within each one of those institutes and centers, women's health is addressed in some way, shape, or form.
Mhm.
And so the Office of Research on Women's Health was created in 1990 due to
Wow.
concerns about inclusion of women into clinical trials. Because if you know a little bit of history, in the 70s and 80s, women were actively excluded from clinical research that was federally funded. And so that was the first mission of the office, to help ensure that women were included into clinical trials.
Wow, that I mean is incredible. I think just launch pad for all of the amazing work that you're doing. And I think on that note, because we definitely have heard the statistics and really seen the need or the push to really be intentional about including women or just making it more inclusive, more holistically. Would love if you could share a little bit more around maybe the work that you do at the NIH. How does the NIH and your department ensure that clinical trials are more inclusive or just representative of, the diverse population?
Right. So, for clinical trials to be meaningful, the population that's tested needs to be similar, at least, to the population for which the intervention is intended. And so actually, from an inclusion perspective, inclusion of women and minorities was mandated in 1993 by the
Mhm.
NIH Revitalization Act. And overall, uh, you, the inclusion of women in federally funded clinical research is quite good today. It's been roughly 50% of clinical trial participants um, enrolled on to, or participating in NIH supported trials are women, and that's been true for about a decade. And so some of what we think about today is how to make sure that the research that's happening today is aligned with the healthcare needs of women. And
Mhm.
that is a little bit more complicated just because for so many years, historically, we've we didn't have clinical research that was centered around women's health, right? Like we
Mhm.
were only included only like 30 years ago, really,
Right.
even. And so, that's a lot of what I do is look at what's going on and how can we make this more relevant to women and
Mhm.
how are there issues that women might be having that are being overlooked, and work on how to get those things incorporated into the ideas that are coming from investigators and into the NIH activities.
Wow, that's incredible. And I mean, I would love to double click on some of these aspects specifically around just clinical trial and inclusion, especially since that, I mean, continues to be such a huge area of importance, even though it's definitely been a big gap for some time. I would imagine that, intersectionality, I would imagine just plays, such a big role as well in some of the work that you're doing. I'm so curious if you have any strategies or frameworks that you use to really ensure that all kind of groups or different groups of women are adequately represented.
Yeah, so our office supports something called the U3 program, which is
Hmm.
exactly that. It's a framework to think about disparities amongst populations of women. So women have historically been underrepresented, underserved, and underreported on. And so the goal of the program is to identify and support research that looks at diverse populations of women and specifically NIH disparities populations, which include
Mhm.
underrepresented racial and ethnic populations, people who are financially, socioeconomically disadvantaged, people from who reside in rural residences, sexual gender minority patients, and people with disabilities, and
Mhm.
look at the factors that either perpetuate disparities or contribute to disparities or potentially interventions that can help overcome disparities amongst those specific populations of women.
Wow. It's amazing that there seems to be such like a very foundational framework that really is taking into consideration all of these various aspects that you mentioned. One of the areas too that you were kind of touched upon that I would love to learn more around is kind of the considerations of sexual identity and gender identity when it comes to, clinical research and how you're kind of thinking or approaching that aspect as well.
Yeah, so I'm just going to go do a little bit of historical context again because because just like women weren't included into clinical research until, the 1990s, the the sex is a biological variable policy of the NIH was only published in 2016, so not even 10 years. And that
Mm.
policy laid the expectation that female cells, female animals would be included in research unless there was a strong justification for use of a single cell. And that
Mhm.
really was groundbreaking. And now that we've had that policy for nearly 10 years, it's sort of amazing to think that like scientific experiments on things like cardiovascular disease or kidney disease were occurring using only male mice. It seems
Mhm.
it seems so strange, right?
Yeah, definitely. Totally.
But that is one of the ways that we're addressing sex because there are different components of sex that influence outcomes for women, right? It's not just one thing, but it's a combination of things like your anatomy with your the hormonal environment for women that's very different than for men,
Mhm.
with, things like metabolism, even cellular metabolism is, more likely to be, um, fatty acid driven rather than carbohydrate for
Mm.
female cells. Like there's there's just so many things, and then of course your chromosomes too and your genetics. So there are all of those things that are very important to think about in terms of women's health. But there's also the social environment, and so we
Mhm.
also think about gender as a multidimensional variable that influences health. So it's not just gender identity or your own sense of self, but also your gender roles and norms, or the expectations of you based upon your biological sex and relations, or the way that you interact with other people, and also power, or access to resources that is often different for women in our society.
100%. No, I think that was really interesting too. I think just hearing some of like, all those nuances is so fascinating. So I'm just like I'm now officially very, very interested in just like diving into this rabbit hole of all of this. I think Dr. Sarah would love if you could share a little bit more. I think you did a really kind of great job of just highlighting the landscape and all the areas of opportunity. I think kind of in your position, being essentially on the front lines as well, and then now kind of being in this hat and wearing this hat, what are some of the barriers that I think you've seen when it comes to, I would say, just recruiting women? And then also maybe like if there's any even nuances between recruiting women and then just conducting research or clinical trials with women participants, if there's any challenges or barriers that you've seen particularly.
Yeah, I mean, clinical trials recruitment is so complicated, and there's so many factors involved in getting patients interested in clinical
Mhm.
trials. You know, a lot of clinical trial participation, and getting diverse populations enrolled onto clinical trials has to do with engagement, like provider and physician engagement, and just being asked.
Mhm.
And so, the office actually has a toolkit for inclusion of women into clinical trials that's available. But there also are like enrolling in a clinical trial can be very time consuming, right? And can involve financial costs, and may and that may have different barriers for men in general than women, in
Mhm.
general. And so, also, if the health outcome that's being investigated is not interesting to women, then they might be less interested in enrolling in a clinical trial.
Definitely. No, that makes a lot of sense too. And I'm kind of curious, like when you just like been in this space for a long time and kind of seeing some of like the barriers and the challenges. And when you said that you kind of entered this role as associate director, like in 2020, it must have been a sight to behold, to say the least. I mean, have you noticed any like changes in trends when it comes to maybe like awareness of research or recruitment or engagement with patients? I don't know. Have you noticed anything interesting in the past, 5 years since like the craziness that was 2020?
Well, I came in the office in 2021, in the spring of 2021. So,
Oh, okay, so you
it's
slightly
been
less
a
crazy.
yeah, like we were all like in our pandemic routine.
Yeah,
Um, it's just been like a very, very exciting time to
love that.
be involved in women's health. There has been so much excitement. People who have never thought about women's health before have
Mm,
so many questions and are so excited about women's health. People who never thought about things like a cervix or like a tampon are um, are have been, in my experience, very open to kind of learning more and seeing that there have been some gaps, and thinking about how we can all fill them as a community and as a society.
That's incredible. I love that. And I feel like, and for folks on the call that are interested or even actively kind of in the clinical research role or interested in pursuing the clinical research role, can you tell me a little bit more about just kind of your role as an associate director of clinical research? Kind of what does a day in the life look like for Dr. Sarah?
I'm going to bore everybody to death. Um, no, it's a lot of listening to a lot of different people. Um, I think it's like a lot of jobs. It's figuring out who has what needs, who has interesting ideas. One of the things that I really, really like the most about being in government is that you get the opportunity to match make, or you might hear
Mm.
like one person in one space talking about some very smart idea. And then, the next week or the next month or even sometimes the next year, like somebody else has something similar to say, and you can be like, oh, you guys should totally meet and get together and create something amazing. Um,
I love
so
that.
I think that's that's a lot of what I do, and it's a lot of herding cats and like hearing what different people have to say, and then pulling out like whatever the common theme is or what the common incentive is, so that we can move forward and work together.
That's amazing. I love that. And I think kind of on that role too, knowing that you are kind of playing, the role of the connector, of the kind of the bridge between all of these incredible ideas. Can you tell me a little bit more around kind of what you think the skills or the kind of experiences that you feel like have been really, really crucial to your success in this role?
Oh, I mean, I will forever be grateful for my time taking care of patients.
Hmm.
I just, I cannot say enough about how much you learn from taking care of people in, when they have a cancer diagnosis in what is a very vulnerable time, difficult and challenging time, for people. And so I think, for all anybody who is interested in oncology out there, it's just like the most rewarding thing, to be part of somebody's life, when they are going through a hard time, and uncertainty. And
Hmm.
so, I think that's the foundation for everything that I would ever want to do in my career is around patients.
I love it. It's like a very beautiful like North Star that I think has been kind of like ever present in your career, which is so incredible to see. And just all the different ways that you kind of continue to apply that.
But that's why clinical research is so important, right? And it's because it gives people options. And most people, when they're presented with an opportunity to participate in a clinical trial, they want to do it. And they want to do it not only because it may or may not benefit them, but because it will benefit, future generations.
Definitely.
And that's like how we know how to treat a lot of different things is because there were people who were willing to, take a risk, and provide their information or their data, so that other people learn.
That's amazing. I'm so curious. Because you hear about this in the periphery, but you are the expert. So now I'm going to actually know for sure, definitively. Are you kind of seeing a broader or bigger push kind of towards like remote like monitoring kind of in clinical trials, or just I guess very like asynchronous, kind of using technology, wearables, et cetera, to be able to kind of capture data compared to fully in person? Have you kind of noticed a trend, and do you feel like that's like still getting the efficacy that you need?
Yeah, so I think that there are a lot of ongoing NIH studies that include wearable data, and and I think that's like a very easy, like sharing data is a very easy way for people to participate in clinical research, because it is really low risk, and
Hmm.
it's very, and that data is very valuable. But there also has been, more and more interest in what we call decentralizing clinical trials, or
Mm.
trying to be able to conduct research activities either remotely. Things like consent can be done remotely, or even for some people, depending on the trial, like the intervention can be done remotely, like through telehealth, um, or those types of things.
Mhm.
Because, and I can give an oncology example again, just because I know it off the top of my head, but, like,
Yeah,
uh, from, from, on, from all of the oncology patients in the United States, it's only, it's less than 5% of them that participate in a clinical trial. And so if we were able to make clinical trials and clinical research more accessible, then we would have that much more power to our acquisition of knowledge.
definitely. Wow, that I didn't realize that kind of very significant like disparity between those that are actually involved in clinical research. And I feel like it's really interesting to see how like with telehealth, with all of these different applications, hopefully we are able to increase access in all of these amazing ways. That's incredible. I do want to make sure that I mean, I have so many questions for you, Dr. Sarah, but I want to make sure that we get to some of our audience questions as well. So I'm going to go ahead and head over to the Q&A section and the chat and just start asking you some questions. So
Awesome.
one of the questions that we have from our audience members is, um, to what degree is patient recruitment an issue in NIH clinical trials? Do you feel like there's any kind of significant issue with just recruiting patients?
I mean, this is going to be each trial has its own specific barriers or opportunities. I don't know that there's like an overarching um, overarching barrier, but
Hmm.
you want to look at the individual place, and once we have a clinical trial open, we do try very hard to make to anticipate that being successful, and if there are problems with recruitment, sort of how can we help to fix that issue? A lot of thought goes into those things.
Nice. Awesome. Our next question is there an attempt to expand study participation by partnering with federally qualified health center populations? Right. And I think on that, like to my piggyback question on that question is, I think I'm so curious to see how you think about like kind of collaboration or partnership more broadly.
Yeah, and so this is one of the challenges is having different HHS agencies work together,
Mm.
and FQHCs are a very specific population. The patients who are seen in in those settings typically are underinsured or uninsured, and so it's a very important population to be enrolling into clinical trials. Just in terms of, again, what we talked about making sure that clinical trials, the patients enrolled in clinical trials are representative of the patients for which the intervention is intended. And
Mhm.
so there are some ongoing collaborations, and we hope to have more.
I love that. And we have another question that says, how are you prioritizing disease/disorders that disproportionately impact women like autoimmune diseases?
So it's very exciting because it's been, gosh, in we have it within since I've been in the office, we have a office within our office, which is the Office of Autoimmune Disease Research,
Oh,
which was
wow.
yeah, which was created just to fill that gap, and to make sure that autoimmune diseases, which are predominantly occur in women but not exclusively,
Mhm.
that the management of the research across the NIH is coordinated, and so that's been really exciting to watch that office sort of get up and running, and start its activities. Um, the Yeah, so but at the same time, I just want to remind people who are listening that most of the research that gets funded by the NIH is what we call unsolicited. So it's just
Mhm.
investigators having ideas and submitting applications. And so the more that we receive applications on specific topics that people are interested in, the more that sometimes may lead to more funding for a specific condition.
100%. I love that. The next question is, how can AI play a role in addressing barriers to women's health?
I'm sure there are, but I don't have any at the top of my head, so I am not sure exactly what the application would be. I think it depends. There is research on things like using AI to assist clinical decision making. Um,
Mhm.
and again, that's going to be, a lot of that is going to be investigator driven too.
For sure, 100%. We have a question that says, what advice would you give someone who is passionate and wants to work in women's health but does not have an MD degree?
Oh, there's like 1,000 different ways to work in women's health. Um, I mean, even just like reading about it and writing about it is important. And I would say even just talking to your friends or your family about women's health needs and what's important to women about their health is just like an amazing contribution that anybody can make. For so long, like there's people feel, I think maybe still do, even though probably I don't feel some stigma about talking about things like menstruation or discharge or and menopause, for example, was something that people just didn't talk about. And, look at what we have right now. Like people are talking about menopause.
Hmm. Hmm.
And that started because people felt comfortable or that it was important enough um, to start conversations about it.
I love that. That is so true. And it really just kind of speaks to how it really is like the smallest impacts and like the smallest details can really, light an incredible fire. That's amazing.
Yeah,
No,
our current
there's so many other questions, incredible questions. Oh, go for it, Dr. Sarah.
Oh no, I was just going to say like I don't think we would have be having our like current conversation about menopause if like
Yeah.
a few very brave women were like, I am hot.
Yes,
Right?
100%.
I am 50 and I am hot.
Yes, that is very, very true. It always takes like the couple that are brave enough to share their
Yeah.
experiences. And we love that for them.
Yeah.
We still have a lot of questions, but I think just the one that maybe we can end on is because I'm also kind of curious too. Are there any kind of like certification courses or things for clinical trials at the NIH? Do you do any kind of like further education or learning?
There's tons of education and learning that's available at the NIH, and I'm probably going to refer people to the Office of Research on Women's Health homepage, and there's like an education system an education tab that has
Mhm.
a number of courses that are free and available to anybody to just learn about sex and gender considerations as they apply to human health. And so for anyone that's interested in women's health, I think that's a really great resource and place to get started on education.
That's amazing. Well, I know that we are at time. Thank you so much for sharing your wisdom with us. For folks that do, because we actually still have a couple of outstanding questions. We do have Sarah's LinkedIn information in the chat if you want to reach out to her. We definitely need to have Dr. Sarah back on with us again for maybe a part two of this conversation. So let's definitely try to get that in the books at some point. Wanted to thank you all for an incredible year of Women's Health Tech Wednesdays. Happy holidays. We will see you all next time. Wanted to thank our sponsors for sponsoring this incredible conversation, as well as one last shout out to our guest, Dr. Sarah, for her just words of wisdom for an incredible conversation. Thank
Thank
you,
you so
Dr.
much.
Sarah. All right, everyone, have a happy holidays, and I will see you next year, 2025, for Women's Health Tech Wednesdays. Bye, everyone.